All right, Sleeping Beauty, Handsome Prince. You got it? A bit of a stretch, but you got to stick with me on this one. Got your nose. Wake up, Sleeping Beauty.
Hey, you.
Hey. Told you.
Morning. Hi, Mom. Oh, my goodness. Hey.
Here, give her a hug, okay? Just be careful, be careful, be careful. She's a little sore.
Oh, God, it's so good to see you. Joe, let him sneak in. I miss you. I miss you, too. But I'm going to be home really soon, I promise. Tad said you've been so good that Santa might actually come to see you, huh?
What might? I painted a target on the roof you can't miss.
Hey, Joe. Thanks for letting Junior sneak in. I just couldn't go another day without one of his hugs.
How you feeling?
She's still hurt.
Better.
Discomfort from the incision is normal at this point. Your mom's doing fine. You can get up and walk around some today.
What?
Good.
So soon?
Oh, no, I'm ready, really. I want to. I want to go see my brother. How is he? How's Del?
All right, come on. Petra's waiting. Enough of this. Remember, release comfortably. Give your mom a kiss, okay? Right there. Put your tongue right there. Right there.
All right, have fun on your nature walk.
Okay.
Say hi to Petra for me, all right?
Bye.
Be careful.
Have fun.
Bye.
Bye.
Oh, that was nice. Now, does Del hurt like I do? And more importantly, is his kidney working?
Not yet. But that's not unusual. He's still on dialysis.
Uh-huh. And how long before it kicks in?
Well, it's hard to say. Could be days, maybe even weeks before a transplanted kidney opens up and functions on its own.
Meanwhile,
Meanwhile, we keep him on dialysis, anti-rejection drugs, strict monitoring of fluid intake and outgo. I mean, your brother's doing as well as can be expected.
can he have visitors? I mean, can I go see him?
Now?
I think he might appreciate a brief visit.
Whoa. Wait a minute. I mean, she just had major surgery here. Maybe a spin around the room is enough. You don't want to push yourself.
He just said I could walk.
Walking be good for her. Really, we encourage post-op patients now to move around soon after the operation as they can manage. Otherwise, fluid builds up in the lungs and invites pneumonia. So I think, really, a slow stroll to Dell's room would be an excellent idea. Room 406.
Lovely. Now, will you help me out of bed? Please.
Irvin, indeed. Listen, Dr. Rosenstein is a very gentle, very caring physician.
No offense, ma'am. I just don't trust doctors.
Oh, now, nonsense. Come on, you just leave the two of them alone in there. How can Dr. Rosenstein help his patient if
He's my boy. I don't know how much more of this I can take. If anything happens to him.
Was something wrong with Dell? Tell me, what?
Dad, can I talk to you for a second? I got to get a straight answer now. Dell's got some kind of temperature. Dixie's in there, and even Mom is acting a little freaked out. What the hell's going on?
There's no reason to panic. Our nephrology team is keeping a close eye on things. If infection sets in, they'll treat it.
Yeah, but it doesn't mean he's rejecting the kidney, does it?
Oh, Tad, you're jumping the gun.
I'm not jumping the gun. I just don't want to have to wait around for weeks to find out whether or not this thing worked.
Well, his odds are still comparatively good.
Compared to what? Poor guy's in there burning up with a fever.
But just hope that's temporary. I'm sure they'll bring it down.
Yeah, but how? And when? Listen, I don't mean to sound selfish, but if Dixie's gone through this whole thing, I mean, giving up a kidney, not to mention any idea of having another baby for nothing, I don't know if I'm going to be able to handle that.
We're going to increase your anti-rejection drugs.
Whatever you think is best, Doc.
My boy's gonna be all right, isn't he? You increase the drugs and no more problem, right?
Well, we're going to do everything we can to avoid as many problems as possible, Mr. Hunkel. Dell, is there anything we can do to make you more comfortable?
No, thanks, Doc.
Miss Martin, I'd like to go over his chart.
They're gonna fix you up, son. You're gonna feel better soon.
His latest blood work shows high levels of BUN and creatinine.
I'll prepare the new IV. Doctor, won't this increased dosage compromise his immune system?
Well, it's a risk, but aggressive action is called for to head off rejection, in my opinion, and the patient agrees.
Oh, of course, Doctor.
You hang in there, Del, okay? Didn't come all this way to get sidetracked by a little fever now, did we? You're gonna be fine. I know you are. Look, they've adjusted your meds. They're going to fix you right up. Everything's going to be fine. I'm positive. All right? I'm praying for you.
Thanks, Dixie. Everything copacetic in here?
Fine. I'll be back soon, okay?
Glad to see you're up and around.
Yeah, I'm okay. Sleep tight. Don't let the bedbugs bite.
I'm gonna be right outside, son.
Still with Petra?
He's fine. They're having fun. Now, can we please just get you back into bed? Okay?
Dixie. Dixie, is it true what you keep telling everybody? That you're okay?
Well, I'm sore, but otherwise I'm fine.
I'm so glad to hear that, honey. I can't thank you enough for what you've done for your brother. I wish it could have been me. I wish there was something, anything that I could do.
You can pray for him.
I'm doing that. Of course, it's been a long time since the good Lord heard from me. I expect he forgot the sound of my voice.
Well, I'm sure he hasn't forgotten you. He never forgets. Just give him a little time.
Come on, honey.
You care about Del a whole lot, don't you? More than anything. More than yourself.
I do. I hope that doesn't hurt you, Dixie.
There was a time when I hated you for caring so much about him. I mean, he got everything, and Will and Melanie and I, we got nothing. But, see, I love Del, too. I wouldn't have given him my kidney if I didn't. You're not the only one praying for him, you know.
Okay, careful. You all right?
Mm-hmm.
Come in.
You left word at the nurse's station. You wanted to see me, Dixie?
Yes, Dr. Rosenstein. Do you know something about Del's condition that we don't?
Well, right now we're doing everything we can to help him, which at this point includes medication adjustment and careful monitoring.
Wait, what do you mean a medication adjustment, like he might lose the kidney?
No, we don't make predictions. We take precautions.
Well, it is an honest question. I mean, it deserves an honest answer. It is Dixie's kidney we're talking about, or at least it used to be. Is his body rejecting the kidney? That's all she wants to know.
Well, at this point, there's no cause for alarm, but there are some counterindications regarding the organ transplant. Del's blood levels are high in urea, nitrogen, and creatine. It's not a good sign. But I repeat, there's no point in expecting the worst scenario at this juncture. We're doing everything we can to level him out. With any luck, the kidney will open up in a few days.
If it doesn't?
No, we're not going to think about that. Just going to think positive thoughts. That's all we can do, right?
Yes. It takes great patience to see a family member through an ordeal like this. But it's important for you to rest, Dixie. Take it easy. Remember, you're recovering from major surgery yourself.
I'll be careful.
Yeah, I'll make sure she will.
Happy holidays.
Thanks, Doc. Think positive thoughts. Is that what you're thinking?
I'm trying.
Okay. Honey, you sure?
I can't die, Ted. I can't.